One more time? Okay. Hello, everybody. Okay. Hi, everyone. Welcome to... Why do I like to do this? Hi, everyone. Welcome to the new episode of Sembang Tak Kosong with me, your host, Edeline. Today, we're talking about traditional Chinese medicine, and we have here with us Associate Professor Dr. Lim Ren Jye. Alright, welcome Dr. Lim to Sembang Tak Kosong.
Hi, I would say it's my pleasure to attend this very special sessions with Edeline.
Oh, thank you. So we're really excited to talk about traditional Chinese medicine today because I understand there's a lot of myths and facts, of course, surrounding this practice. And in Malaysia, especially, TCM is very close to home. You see, TCM centers around, even in hospitals as well. MOH, I believe, has also acknowledged
It's
TCM,
available
right?
in the government as well. There are 15 government hospitals actually equipped with the TCM department.
Oh, wow. There you go. So this is why we really want to talk about it, because I want to talk about the benefits about it, as well as, about heaty and coolingness, which is that all what TCM is about, because I really do wonder. Perhaps we can get started, Doctor, by you telling us what TCM is.
Okay, just now when you're asking me about whether there's any TCM in the government hospitals, in government settings, the TCM is more comprehensive in the sense that they define the TCM as traditional and complementary medicine.
Okay.
So it's not restricted to TCM traditional Chinese medicine alone.
I see. Okay.
Because since 2016, we have this Act 775 being passed through the parliament, and that define TCM Chinese medicine is one category under the traditional and complementary medicine. Okay, there's another 6 more, which namely is traditional Malay medicine, traditional Indian medicines, chiropractor, osteopathic, homeopathy, and then Islamic medicine. But those are widely practiced in Malaysia with the most registered practitioners is actually TCM, traditional Chinese medicine. So traditional Chinese medicine itself is actually a medical practice which has been practiced for more than 2,000 years. It's a medical system whereby they are treating the root cause of the problems instead of treating symptomatically. So they have a different interventions available, namely acupuncture, herbal medicine, moxibustion, cupping, dietary advice, tuina, and so on and so forth. That's help us to align us to the external environment. The idea would be something like I'm more towards like someone fine-tuning a musical instrument. So to make sure the sounds good and right, and is synchronized with the external environment. That's about traditional Chinese medicine.
I see. Okay. So as you mentioned, there's different areas of TCM as well. So a lot of people commonly understand TCM as it being just herbal. Yeah, I mean that's the common misconception, right?
Yep.
Okay.
In fact, TCM is not restricted to herbal.
Okay.
Neither restricted to acupuncture. Definitely, these are the 2 main pillars of TCM.
Okay.
But we have others. We have others. For example, like moxibustions. You have any ideas about what's moxibustion? That's a mark wood roll.
Okay.
Okay. Then we burn it. I always kidding with my patients, like because when they enter into my room, they will ask me, Dr. Lim, are you a smoker? It's sometimes embarrassing because they smell some cigarette smell in my room.
Okay.
But in fact, it's actually from the burning of the moxa roll.
I see.
That we use it and then apply it onto a certain acupoint for the patients to achieve a certain therapeutic effects or wellness function.
I see.
And then the smell itself actually will be spreading around and making my shirt, my hair. So every time I end up lunch with some of our management in Sunway, then they ask me, what happened to you? Then I tell them, very good business today. That's why I end up full of a smoke smell. So moxibustion is one of it. And then we have cupping. This is actually a common practice in the others modality. For example, Malay medicines, they have become. So in Chinese medicines, we have our own philosophy.
Okay.
Trying to use it to achieve the balance between the inner constitutions and the external environment.
I see.
And then we have dietary advice,
Okay.
and then we have manipulations, and then we have others, what we call a herbal patch that can be utilized to reduce the allergies type of conditions, which you have to apply it on certain seasons, certain times, that will maximize the therapeutic function of the intervention.
Oh,
Something
wow.
very special. There's wide spectrum of the interventions available.
Yeah, that's right. Wow, there's so many different areas
Yep.
actually. So it all depends on firstly what the condition is. I mean, what the issue is. That's right, doctor. Okay. What got you interested in TCM actually?
Okay, I'm actually a medical doctor.
Yeah.
Also, I was trained in International Medical University, IMU. So I still remember in my 5th year of my medical student life, we need to do walk round,
Okay.
And then present case to our professor. One of the very classical scenario actually I encountered is there was a patient admitted for generalized edema, jaundice, the abdomen distended, very big dummy. And then the professor bring us to the bedside. Look at this patient. Ask the patient, what did he take? Okay, then we ask, Oh, then the professor point out, did you discover he is taking herbal medicine before being admitted? This is the side effects of taking the herbal medicines, end up with liver failure. Okay, that's how typical we as a medical student being trained. That's the risk and danger of taking the herbal medicine. So then he left. But after we further dig out, what actually happens to the patient is, this is actually a hepatitis patient, has been there for many years. And then before the patient is being admitted, he's actually taking the herbs trying to reduce the jaundice and reduce the edema. And it works for him. So by the time he admitted, it's actually the conditions has been somehow being partially resolved. But the family members insist he has to come in. So he even showed us the picture before he is being admitted. So then we start to realize, is that the whole story of the pictures of what happening to these patients? Because patient is trying to tell us the other aspect of the condition. So I see that if we know both sides, how TCM and the Western or the modern medicine can work, it's actually like we have two lenses, a superpower clear full lenses that we look into illness, not only from one angle of Western medicine, but at the same time, we can understand the illnesses from a different angles that provide a comprehensive type of treatment for our patients. So that's eventually I found out, seems like there is something that we can use in the herbal medicine that can relieve jaundice, whereby in our clinical practice, modern medicine, there's no such medication, but there is something in the TCM.
I see. But that's the thing, right, doctor? Like you mentioned also, the perception as well of TCM, it's not the same throughout everywhere, of course. So what is commonly perceived is herbal medicine equals bad.
Sometimes you may even hear there will be the patients or the doctors will ask me, is there a steroid inside there,
correct.
Dr. Lim?
I get that a lot. Yeah,
is there painkiller inside there?
Correct.
Every time when it works well, the next thing they will come back to you and ask you, hey, are you sure there's no steroid? It works very well for me. That's the typical type of questions the patient will throw at us. But in fact, we are fully realized that how the TCM can work. It's not only restricted to the chronic illnesses, sometimes for the flu, sometimes for the acute pains, or even the migraine the patient has been suffering for many years.
Yeah.
So when the patients present to us, the way we treat is more looking into the root causes in terms of just treating symptomatically.
I see.
So maybe sharing with you what the latest practice we have here nowadays. As what you can imagine about TCM is in a very old, ancient type of medical hall with an old uncle standing behind the counter and then taking all different leaves and different roots coming out.
With the
and then and then I keep on measuring and then pack it into one and ask you, you don't even, there might be some chit-chat inside there, some centipedes inside there, or even there's a lot of imaginations inside there.
Yeah.
But nowadays, if you have chance, I do invite you all to visit my center. You'll find it. The ideas of the TCM center now is totally different. The medicines the medications we are using is actually fully modernized in the sense that all these herbs and leaves has been processed in the factory, GMP certified, and then they have been processed and then vaporized, condensed into powder form. And this is actually a Japan technology. Wow. Japanese, they are the largest consumer of the herbs around the world, besides the China. So they have to use a way to make sure their people or consumer can take the herbs easily and in a convenient way.
I see.
So with that, they have converted into the powder form, just like our Milo powders. Okay, you can go anywhere, 3-in-1, tear it off nicely, and have mixed with some warm water, you drink it. Then
How
you can have
convenient.
Yes, and then the taste is not bad nowadays. It's not the bitter type that you can imagine last time. So you can see the evolution of the TCM is actually following the trends of the modern medicine as well.
Yeah, okay, because I used my grandma used to boil for hours and then the whole house would smell,
Yeah. And then they will tell you 5 bowls of water into 1 bowl of water. Then you have to keep on watching, looking into is there still any more water left?
That's right.
Yeah, this is something overboiled sometime,
Yeah, so
but nowadays it's totally different.
Wow, so let me guess, it comes in sachets forms?
Yes, you are right.
Does it come in maybe pill forms as well? Capsules?
That's extraneous. That's another different story about it. But if it's this request from the patients, then we can actually help it to make it in the capsule form.
I see. Wow. Okay, that moves on to my next question then, doctor. In the modern medicine, you have all sorts of diagnostic tools. You have X-ray, MRI, whatever not, right? How about TCM? So the common understanding is always TCM means traditional, meaning no, nothing digital. So how does that go with TCM?
So the TCMs and the examinations are mainly composed of 4 components. Okay. In Mandarin, we means 望闻问切, which simply means that observation, inspection.
Okay.
闻, which means smelling, or hear, listening to the patient's voice, the way they talk, or smell it when the patient come to your room. 问, inquiries, asking for the history of the symptoms. And 切 definitely is the pulsations, taking the pulse, and they know the body's inner constitution. So all these things sounds very manual. No AI component, no high technology. But for informations, lately, and then by end of the month, I'm going to visit to Shanghai. Part and parcel of my visiting lecturers in Shanghai University of TCM. At the same time, we are going to have conversations and dialogue with some of the AI technologies company in China, whereby nowadays they actually have been using technology to help the physicians to make the diagnosis taking the pulse, looking into the tongue, and then looking into the facial complexions, and then they can come up with a diagnosis with you, and even coming up with what points you should put for this patient. Acupoints to put for this patient that will actually adjust the patient's inner environment. At the same time, what diet the patient should take and what patient you can actually consider when you prescribe.
Oh, wow.
So actually, it's totally different from what I've been taught. That was about 15 years ago in China. And now when I visited to my university, the teaching is VR, is AI. You can't really imagine how fast the pace of the technology has actually brings the evolutions to the industry. What I'm trying to share with you is some of the TCM medical students, they're actually wearing the VR gadgets, and that's how to do the physical examinations, which point of the acupuncture point they have to poke by just using VR. That's actually totally opened my eyes wide shut. I can't imagine it's reaching up to this point.
Yeah,
and
correct.
That's why the vendor or the suppliers and some of the people, they are seeing a lot of opportunities in Malaysia, because we are among Asians. I don't know why. The comments from the outsider is TCM in Malaysia used to be a most reputable and credible TCM practitioners in ASEAN.
Oh, I
besides
see. Wow.
China, you know.
Wow,
So
okay.
we receive a very highly credible reputations
Yeah.
among others. So I even have Indonesians or Thailand patients actually fly all the way to Malaysia.
Wow.
So
Okay.
China people is saying that Malaysia is actually the platform that actually they can use, try to spread, of course, of selling their products to all others as well. Lah. So they want to engage with us. So this
see.
round, that's part of it, that of our dialogue, that we look for collaboration. Another thing is in Malaysia itself, our government is more open-minded, I would call it. This is something very special, whereby we fully encourage the integration. That's why the government take the leads at the beginning. You can see it. So they incorporate, try to, because I was the head of the policy and development of a Ministry of Health under TNCM division last time.
Okay.
So we have been actively identifying, this state, there's no TCM department. So we go to the hospital and try to identify and then engage with the physicians there. So we managed to about 15 government hospital that's equipped with the TCM's departments nowadays.
Wow.
So you can see the passions or dedications and policies being set by the governments actually pushing the integration. At the same time, we from the private side actually actively try to push it the way that we integrate both together.
Very interesting, Doctor. Just a question that came to my mind. After MOH implemented, TCM and all the complementary medicine, right?
Yep.
Is there like any statistics to show like how it has helped the community?
Yeah. If you look into the report, every year, every year, they have to come up with the annual report.
Okay.
So you will see the feedback from the customers. And then they have conducted some cost efficiency studies.
Okay.
For example, like acupuncture, whether it's able to reduce what painkiller cost.
Right. Okay.
Yeah. And even there are some study trying to use acupuncture to relieve methadone dependence withdrawal syndromes that's been done in HKL. Because methadone is very costly, painkiller also very costly. So they are trying to see whether this TCM acupuncture able to help. And even in our center now, what we are doing is we're using acupuncture to relieve the psychiatric-related disorder, like depressions, like anxiety disorders among the cancer patients to improve their quality of life. So it's still ongoing observational studies. So from all this data, there's actually more and more growing evidence to say that actually it reduces the health burdens on the government side. At the same time, it's actually efficient and effective in treating symptoms. And this is actually being recognized by the WHO, the World Health Organization. So you will see in the WHO reports, there's about, if I'm mistaken, there are about 43 symptoms or illnesses being included as an indication for acupuncture.
Oh, I see.
So we are seeing more and more positive feedbacks. And as compared to the times when I first come back to Shanghai, after my master in Shanghai last time, the difficulty that I'm on, or the challenges I'm encountering during that time and now is definitely much more comfortable for me to actually push it to the Western side.
Oh, okay.
Initially, we face a lot of challenges.
I see.
I did share it in some of in my books as well. I recently published a book, so I shared it in the books. And what are the challenges we encounter with the oncologists, with different physicians? But nowadays, you can see they're actually more and more open-minded.
So better recognition is being received around the world as well when it comes to TCM. Doctor, just wondering, can TCM treat all medical conditions, or how does it usually go actually?
There are some misconceptions whereby TCM only treat chronic illnesses and only for uncle, auntie, or tato, nenek, you know. All the young people, you never touch like all the teams member here. Wow. You never encounter, you don't need to use the TCM. But in reality, the core philosophy of TCM is actually prevention. They're talking about a lot of prevention. But the thing is, nowadays, our healthcare trends has been modified into such a way we only look into what? When the patient fall ill.
Correct.
Then you go to seek for the doctors.
Correct.
Okay, if I'm not sick, for what I'm seeing a doctors, right?
That's a perception.
So the idea is actually not correct. We should actually more focus on prevention. So TCMs have put a lot of emphasis on this prevention.
Okay.
And then the idea of only treating chronic illnesses. But in reality, I can share with you one of the classical examples that's always come into my mind is I do have a patient. It's actually an ovarian cancer patient.
Okay.
Because my subspecialty is in oncology. The patients enter into my room in a band position. It's a lady. She can't, of course, ladies, ovarian cancer. Okay. And then enter into my room in a band position, can't walk properly.
Oh dear.
Okay. She's only about 40 plus, but she's walking like an 80 years old lady. The scarring tissue at the abdomen is actually pulling her so that she can't even stand straight properly.
I see.
Okay, we restrict the whole body movement, including her walking positions and gait. So, what we do is actually we have a lot of TCMs intervention, for example, acupuncture manipulations. After 1 hour, by the time she leave our center, I still remember the sentence she told me, I regained control of my life.
Wow.
She suffered a lot until the point she actually been to physiotherapy, been to different orthopedics, been to different gynaes or doctors trying to see whether anything's able to help her. She can't, but thanks God we have some intervention that are able to help.
Yeah.
And then it's a chronic problem for her.
Yeah.
But after we do some manipulation, acupuncture, it helps. So the patients, by the time walking straight up the way, going to out from our exit, the whole team feels so appreciate and satisfied with what she's able to achieve.
Wow.
So that's what I'm trying to share with you is we are not only restricting to chronic illnesses, the flu, the headaches, the pain, some just like my common diseases that I'm actually encounter, not only cancer, although I'm hoping to see only cancer patient, but because you know about both sides of the TCM, the Western medicine, then the patients with all sorts of, I would say the most rare type of diseases that I never encountered in my life, only read it into books, and then they end up in your clinic and showing to you and asking you, Dr. Lim, are you able to help? But sometimes for doctors, it's very bad. We don't feel comfortable to say no to the patients because patients are all the way from East Malaysia flying here on Penang, all the way the night before have to come to KL to stay overnight to see you, and then you say, sorry, I can't help. So that's something very annoying for myself. I feel so hopeless and we can't help the patient. So we try our level best to try to do some things, but it's like what I've been sharing, the type of diseases that we encounter nowadays not only restricted to cancer alone, chronic kidney disease, because nowadays when they see their renal functions keep on deteriorating, then they will start to aware, I'm so worried about it that I may need a hemodialysis 3 times a week. So, but I'm asking them, your nephrologist telling you, you better don't take the herbs because taking the herbs later you will end up with kidney failure. So what I always advise them, because they will ask me not about only the TCM in some way, but at the same time, how about the TCM out there? So correct. Any form of intervention, I will always advise them, you do a blood check, a blood test 1 month after taking the intervention. No matter it's TCM or whether there's any other medical practices, then you see whether there's any improvement or deterioration. Then you will give you a clearer picture. It helps, it helps. It doesn't help, it make it worse, then you have to be cautious. So it's very fair. So then after we explain to the patients, then they'll start to aware, seems like you can do something. And then after they figure, wow, the improvement. Then they will follow with you. But if there's no improvement, then sorry. We try our level best, whatever acupuncture, moxibustion, or herbal medicine we have provide to you, but it seems it doesn't help. So there's nothing like 100% cure, especially in medical treatment. We have to believe that. Even paracetamol, you know that? 30% actually only works.
I see.
Not all the time. And that's considered popular medications among Malaysian,
Correct.
But you do aware that what's the problem with paracetamol? It's actually liver toxicity.
Oh, I see.
Okay, so you see the thing is when you take the medications for Western our modern medicine, you don't query about, hey, will it have any impact on the kidney or the liver? But when you take the herbal medication, you're like, wow, so many things inside there. It might cause harm to my liver, cause harm to my kidney.
Correct. That's the auto, right?
The perceptions is very rigid perceptions there.
Okay, so doctor, just wondering, because you mentioned like TCM could help in many ways, including like common illnesses like flu, cough, for example.
Acute pain.
So just wondering, say for example, if I'm coughing, how does it go? Like, for example, can I just walk into your clinic? Because, for example, if I'm coughing, the common SOP would be to go to the GP, get my medication, and then stuff like that. Yeah. So is it the same if I were to go walk into your center?
But you need to make an appointment.
Okay.
Because my appointment is very full, but usually I ask you to get some of my other colleagues who's actually well versed in treating this type of common flu.
Okay.
Because TCM nowadays, they have different specialties. We have gynae, we have orthopedics, we have dermatology, we have psychiatry, we have oncology, so different things. So there are people who actually is good in internal medicines and able to cater for your need. So the now I even have the AI diagnostic machines in my center that's able to help you to identify certain body constitution.
Okay.
So the physicians will come in and then we register you, then we'll do a screening. But usually for flu type of patients, we will strongly advise the patients to take a rapid test kit. I don't want you to come into my center and infect my other physicians with COVID, influenza, RSV, all these things. Okay, so that's our standard SOP. And then after that, we will use some gadgets trying to identify, take your picture of the tongue for the observations to know you better. And then you will see our physicians that take the pulse, they ask you about the history, and then prescribe you with the herbal medicine. If they see that if the cuppings or the guasa or some rolling cuppings able to help your condition that will fasten the recovery, then we will advise you to do that. Because when they see you, they will try to identify, whether this is heaty a little bit more or the cooling element in your body is actually excessive. So they will try to correct it. So correct it, whether we want to use the herbal medicine method or whether we want to use the acupuncture method, then we ask you. Then the patient will start to tell you, I'm so afraid of acupuncture needles. So can you choose other ways? Then we use a more a gentle way, non-invasive way that everybody to help you.
I see. And about age groups, can TCM help from babies onwards, or is there like a limit?
It's actually we're always kidding with our patients. It's not only restricted to the elderly, but it's even for the kids because there is a TCM pediatric. I have someone in my center who actually got this special interest in TCM pediatric. And then you will wonder, the kids are asking them to take all these bitter type of concoctions. Who is able to take, you thought is plain water or some carbonated drinks, man, everyone will actually grab for it. But in reality, so what we can do? So they have a different manipulation method. They have some tuina, which actually helps to relieve, for example, fever for the kids using a non-invasive way. And as we have dietary advice. Then we will start to advise the mom, what sort of diet actually you can do? And then, some herbal soup that's actually cater for others as well, that's improve the immunity. If there is anything able to help the patient to relieve some of the common symptoms. For example, you can have some gingers in the herb in your soups or in your dishes that may actually be helpful. So not only restricted to elderly who is able to tolerate all the bitter concoction or the with poking like porcupines. But for the kids, we have a different way of treating them.
I see.
In China, they even have nebulizations.
Oh, wow.
Yes, they have a nebulization using the herbs and then nap for the patients trying to improve it. So you can see there are many other interventions and not only restrict to the elderly.
Wow, and doctor, just for the benefit for our viewers as well. So you mentioned about herbs, improving immune system for kids as well as adults. Could you maybe share with us some herbs in general that could help?
Astragalus, Huang Qi, we call it. This is something that's able to boost up the white cell count, and is a commonly prescribed herbs, and it's also a food that you can put into your soup in the daily life.
Okay.
So I use these medications quite frequently during my practice for my cancer patients, especially when they are receiving the chemotherapy.
Okay, yeah.
Okay,
yeah.
so because one of the common side effects for some chemo regime is actually lower blood cell, or we call it leukopenia, and this actually able to help. But usually we will combine it together with moxibustion.
I see.
There are some studies being done in the overseas medical institutions whereby they found out the moxibustion is able to boost up the white cell count for those patients end up with bone marrow suppression.
I see.
So yeah, that's why you always, when you walk close to me, Dr. Lim smoke secretly. Okay.
All the burning. Okay.
All the moxa rose smell.
I see. Okay. Okay. Besides that, any other like herbs?
Date, the red dates.
Red
Red dates actually is very commonly encountered foods in our daily life. You will take it like even our Muslim friends, they actually take the dates during their Puasa month.
Yeah.
So dates itself is very good to replenish the blood component in the body. Okay. So this is actually when the qi, or the energy level, or the immunity being boosted up using the astragalus. At the same time, the red dates able to improve your blood. So when the blood and the qi, the energy in the body being elevated, so the chances of you of getting sick is actually lesser. So during the COVID times, we have even come up with some form of tea, herbal tea, with a component of these two herbs, actually trying to boost up the body's immunity from this way.
I see.
But we don't directly sell it like we anti-COVID. No. Okay, no such thing. Okay.
Yeah. Is there a possibility of anybody overdoing it? Because you mentioned this herbs.
Very good question. Yeah, there are some in real life when you, as the experts knowing both sides, and you tell patients, hey, go back and take ginger. Especially during a chemo time, you feel nausea and vomiting, right? Okay, so ginger helps in relieving the nausea and vomiting. Then patients go back, and then the next time they come back and see you showing what? Doctor, how come I got so many ulcers and sore throat?
Oh dear.
Okay, because when you tell them you take ginger, they're not only taking ginger, they are going to Bentong all the way. They're buying all the
Bentong ginger.
Bentong ginger, which is very strong.
Yeah.
Okay, and then it's very heaty in our Chinese medicine sense. So they take it like, wow, every day I took two teaspoons of it. And that will help in my nausea and vomiting. But in fact, it only happens in first few days of the chemo, and then relieved by itself.
Yeah.
Then the patient start to take it and end up with the complication. That's the problem is when we advise you to take the food, we are not asking you to take it like medication. The main difference between food and medication, taking ginger for example, gingers, you take it when you cook dishes, you may add in some ginger, you take it. You are not known of the amount of you taking it, so you are not sure about dosage, and you are not taking it every day.
Yeah.
Okay, unknown amount, unknown duration. But if you are taking it, we do have gingers powder in our center, and if I prescribe it for the patient, 2 grams per day, and you have to take it for like 14 days straight consecutively. Then I actually use this as a medication with known dosage and known duration.
Yeah.
So the main difference between food, unknown amount, unknown duration, but medication, known duration, known dosage. So this is actually how you differentiate between the food and the medication.
Okay.
But the patients, when you tell them you can take something like that, then I go home straight away. I take it every day, and I want to get the most powerful one in Malaysia.
Yeah,
and then
like the best of the best. Yeah.
Selling local products.
Yeah.
Okay.
Okay, but so don't overdo it, in other words. So
Exactly.
just take it like normal food. I mean, put it in your everyday cooking. But another two questions, doctor, about food-wise. Okay. Number one, firstly, how do you know you're getting it from a proper source? For example, like chemicals and everything. That's firstly. Secondly, like, won't boiling stuff reduce its benefits?
First of all, I think for TCMs, it's important to get, because TCMs is a very tailored, personalized diagnosis and treatment.
Yeah.
Okay, we see every patient differently. You and the ladies over there and gentlemen over there, they have all different different body constitution.
Yeah.
So medications, even you present to me with the same flu, he got influenza, you got influenza, I got influenza, the medication I'm prescribing will be slightly different.
Okay.
Based on your body constitution. So this is the key concepts in the TCM. When we talk about this, everyone is different. The medication we are prescribing have to be depending on the physician. So physician is the key component. It must be a registered and qualified and trained. So in Malaysia nowadays, all TCM practitioners, if you want to practice, you have to register with the Ministry of Health, the TCM Council.
Okay.
So when you go to their clinic, make sure you see their APC, the annual practicing certificate, which has been displayed in their clinic.
Okay.
So you are seeing someone proper with proper qualification, and then prescribing you something tailored or personalized to your body constitution or your illness at that moment of time.
Okay.
So that's the first thing for practitioners. Secondly, medications, the QC is very important because you worry about adulterations or you add in something, painkiller or steroid in
Correct,
okay.
correct.
So most of like what I've been sharing with you, those in sachet form, in the powder form, they're actually registered products
I see.
with the Ministry of Health.
Okay.
They are registered product, and then get the source from those reputables and registered importers or the companies, so that they have done a QC at the back. And for information, we as a user, we even take the initiative to do the QC testing at the back.
Oh, I see.
Because we worry about whether there's any pesticide, whether
correct.
there's any heavy metals,
Correct.
whether they mix anything to make sure their medication is very effective.
Correct.
Right. So we have been doing this randomly, although it's very costly, but we still think that it's very important to safeguard the safety for our patient. So products and then a practitioner, these are the two key components you have to bear in mind whenever you go to see any TCM practitioners on
see.
getting the TCM treatment.
Okay. But how about, say, if I go to those Chinese medicine shops? How can I differentiate, like, if the products that I buy from that shop are safe? Like, for example, I'm just buying herbs for soup.
Okay.
They say they don't contain any unwanted ingredients in there. Like, is there a way to differentiate or recognize?
For layman, I think it's quite difficult. Quite difficult.
Okay.
So usually we advise you, you know about herbs. Being consumer, we like to choose those things who looks pretty,
aesthetically pleasing, right, doctor?
Yes.
Yeah.
And then if there's some part missing, then you always thought that these are all poor quality. I don't want to take this. Those very tempting types of appearance. This must be good quality, AAA, just like Sun King. Okay. But in reality, is that really the truth? Not really, sometimes.
Okay.
Because in the industry itself, there are some, we call it some unethical. I think so. In every business, there are some ones like that. So, in order to preserve it in a very presentable way to the consumer, they might have some preservative or some additive in order to make it always appear tempting in front of the consumer. So these are things, it's difficult for the layman to actually differentiate whether it's good or not, things like that. So I will always advise them to go for those credibles which has been in the market for long. Then not we always talk about price. Price is the things. If you really want to get something good quality, then you might need to pay a little bit more. Okay. So because The brand itself actually means certain things because the brand itself, they don't want anything happen to them.
Correct.
Maybe at the back end, you just take the herbs and go to send to the Bahagian Kimia, to the chemistry department, and check whether there's any things happening. Then it actually will destroy the reputations for the whole brands itself, So they don't want to take the risk. So the sources of the herbs will be always reliable in that sense.
Okay.
So I always encourage it. You want to go? Go for those reputable ones.
Okay.
And then get it properly. And don't buy it from along the straight side. Oh, this one are 10 ringgit or 5 ringgit. Then you buy it. Then anything happens, you can't even trace the source.
Yeah. Very true.
So that's about it.
Okay. So most important is to do some research, of course, right? And to see, check out reputable brands.
Yeah.
At the end of the day, it's not just about, the cost, yes, but it's also about your health.
Yeah.
Right? Okay. Doctor, just wondering, you mentioned about the tongue. Why is the tongue so important in TCM?
Okay, if I ask you to go out, run 100 meters and come back, what happened to your pulse? It will be tachycardia. It will keep on beating very fast, right? Okay, the pulse will change. It's a real-time reflections of what's happening. Okay, run back. Keep on pulsing. But will your tongue change?
No.
Not really. Not really.
No.
So the tongue is actually some things that reflects your inner environment.
Oh, I see.
The body constitutions
Okay.
that happened for the past few weeks.
Oh, okay.
So by looking into it, this how actually my patients always find that it's difficult to cheat Dr. Lim. Because you advise them, you better sleep early okay, and then because of all this inadequate rest, you end up with all these sore throat, oral ulcers, and then you have even worse insomnia, sleeping disorder. But they will tell you, lately I sleep quite early, but when you take into their pulse, look into their tongue, you must be cheating me. Then they will start laughing.
Oh no.
You say, how come seeing Western medical doctors, they are not so difficult one, but seeing someone like Dr. Lim is they feel so, what do you call it, anxious because they can't tell lie in front of you, you know.
Cannot deceive the doctor.
So from the tongue itself, we know what's actually happening in your lifestyle for the past few weeks, even up to months. Okay. So that it will give us overall pictures. It's not only part of the puzzles, but we have a more comprehensive. Then we know you in and out. And then it will give us an idea, whether I should add in some things in my herbs or doing something more, trying to rectify the condition and bring it back to the balance. Because TCM, the core philosophy is actually what, they're trying to achieve the balance between the energy, the blood flow organ of the inner environment and the external environment.
All right. Okay.
So to make sure everything is aligned. So nothing more, nothing less between the neutral zone. So that will keep you from, because if I always share with my patients, if more, for example, hitting more, it's always indicate you're not achieving fever status, but it's actually a sub-inflammation. There's already a chronic inflammation ongoing in the body. It's not achieving a fever 38 degrees Celsius. But you yourself, you feel the uncomfy is actually happening inside your body. You start to feel it. So I'll share with you another study in Korea. They have done a study in a factory, day shift and night shift workers.
Okay.
And then they take all the bloods from these two shifts of patients. They found out what, those who working night shift, the inflammatory indicators in the body is actually higher compared to those who's working day shift.
I see.
So maybe one day there will be occupational hazards being charged to all these employees who are actually doing. But that's what they found out. And it's somehow explaining why the TCM looking into that. If you don't sleep or rest at night, it's actually bring you the so-called heatiness in the body. It's actually some inflammation is ongoing, but it's not achieving the level of having fever.
Okay.
So the patient, so that's about how because I'm not sure whether you're going to ask me what is heatiness about.
I was going to ask you.
I better tell you. And then these are the studies, very interesting studies, it's Korean some more, because they're trying to find out what is actually heatiness.
Yeah,
is it really fever? No, not 38 degrees, because you go to the GP and tell him, I feel very heaty. And they will say, you just go home because your temperature is not even reaching 38 degrees Celsius. But this Korean study actually found out, that's the reality, the truth at the back is actually inflammatory indicators that have been coming up.
Yeah.
So very interesting.
Yeah, very interesting, doctor. And since you're on the topic of heatiness already, so let's jump into that as well. So this whole heatiness, cooling thing. You explained a little bit more about heatiness just now, but how about cooling? How do you know that your body is too cold?
Like what been shared with you earlier on, we looked into the body constitution for the patient based on 4 examinations methodology.
Okay.
So by combining all these details, we come up with a diagnosis and have an understanding of what your body constitution is about. So one of the signs that we may encounter if you are always cooling type is what? First of all, your peripherals always cold.
Oh.
Okay.
Okay.
That's one. And then for ladies, they tend to have dysmenorrhea or pain during the menstruation.
I see.
Okay. For ladies. And then they even have a lot of vaginal discharge.
Oh, okay.
The vaginal discharge could be some whitish or some whitish vaginal discharge.
Yeah.
So these are some of the signs.
Okay.
And then the symptoms will be the patients, even in a very calm, very warm environment, they are using all the sweaters. So the way they present is, everyone feels so warm, but you're still wearing the sweater. Okay, so that's part of it. And then this group of patients with cooling or cold bodies in constitution. Another thing is for ladies as well, because in Chinese TCM, ladies more tends to have a cold inner environment.
Oh, I see.
And then they may encounter problems like difficulty to get conceive.
Fertility.
Yes, for the fertility issues.
Okay.
So we call it the coldness actually retained in the uterus.
Oh, okay.
And what leads to this in Chinese medicine's idea is you always drink cold drinks lah.
Oh, okay.
You always drink a lot of sweet carbonated drinks lah. And then they even believe that you don't dry your hair.
Yeah.
Okay, especially before you go to bed.
Yeah.
Okay.
I always get that scolding when I was younger.
And then they may present in the bodies. We always call these our patients. They have water retention. They will tell you, I have a very strict diet control, but I still gain weight there. Then this is actually because of the lifestyle. They actually change your inner environment, make it into such a way that it's always water retention and you always feel cold.
I see. So do we blame coolingness for weight gain?
We blame more towards dampness.
Oh, okay.
Dampness.
Dampness.
There are different illness component there.
I
Dampness
see.
is one of it.
Okay.
So when the dampness and then you continue to pour it with cold water into your inner environment, it will lead to cold. Yep.
Okay.
So we blame dampness.
Okay.
So there will be other ways of actually trying to improve the dampness, clear off the dampness in the body. Then you have less water retention. Then you start to have better weight management.
Oh, I see.
So
That's
what are the foods that we can actually consider to clear for dampness?
Yep.
And I kill myself. Okay.
I think this is going to be interesting,
For example, barley.
Barley. Okay.
Yes. And then Chinese yam.
Oh, okay.
You know what's Chinese yam?
Actually, I was going to ask you what's Chinese yam, doctor. I was going to ask you the same as the purple ones.
I'm not sure whether you have seen some yam in a road form, and then it's very slippery, a lot of juice there. You search online later, and then Chinese yam, you'll find it. It's a form of dishes actually we are able to improve the body's basic metabolism.
Is it sold in supermarkets?
Yes.
Oh, okay.
Okay, Chinese yam.
Okay,
And then
Chinese
barley you can definitely get it.
Barley, everybody
And then barley itself, no sugar, please.
Okay.
Okay. laughing there. You know why? Because we are so used to have all these sugar added drinks, you know.
Yeah, especially the coffee shops, right, doctor?
And
It's
then
all like
we have to give a likes to our governments because increasing more and more
yes,
sugar
the
tax.
Sugar tax, yes.
Okay, by the way, so barley is another thing, and then red beans.
Oh,
Red beans is
Okay.
also something that's able to excrete the water retention, the dampness in the
see.
body.
Okay.
So with these three types of ingredients I'm sharing with you, so next time I'm expecting to see a Chamel's, Edeline's in my next
let me
interview
try.
with you.
Okay, let me try, doctor. Then let's see if I can release all the dampness.
No, you look very good, but you can be better.
Okay. Let me try that. I mean, that's interesting. And I think these three ingredients is probably gonna be really popular when people start watching the podcast as well.
So I better stock it up.
yes. But how do you know, doctor, what ingredients are good for, like, for example, to combat dampness, and what's good for heatiness? Like, for example, you say like red bean, barley. If I were a normal person layman were to see barley, red bean, or whatever not, I wouldn't know if it's for what. For example, should I take it when I'm heaty, or should I take it when I'm damp?
That's
How would you know?
very important that you
Yeah.
consult a registered and qualified TCM
Okay, so that's
practitioners.
where Dr. Lim
So
comes in.
I can be coming to. I've already shared with you, but you look for those qualified and well trained.
Yeah.
Another things that I may share with you is besides looking into the different, because I'm interested to know whether my inner body is heaty or cold,
Yeah,
or water
correct. How do I know?
retention or dampness. Another things that I can share with you is because of TCM, they have so many specialties. Always looks for the ones relevant to your signs and symptoms. For example,
okay.
if you tend to have dysmenorrhea or pain during your menstruation, or you are having problem to get conceived, and some patients even have PCOS, polycystic ovarian syndrome.
Yeah.
These are the type of the patients that actually you can look for a TCM gynecology. Right?
Okay.
In Western medicine, we have different specialists
Correct.
seeing into different conditions.
Yeah.
So you look for someone with special interest or the training in this line.
Okay.
Then at the same time, you check with them, then they can treat not only your signs and symptoms, at the same
Also
time,
help.
they treat the root cause of the body constitutions, able to correct your inner environment. So
Okay.
that's to make sure you have a better holistic type
Yeah.
of preservance or maintenance for your future health.
Okay. So, doctor, like you mentioned, TCM also has their different expertise, specialists and stuff. How do we identify? For example, like you said, in Western hospital, you will be able to go under all the specialties and you identify a doctor. But in TCM, how do I find these doctors? For example, if it's for gynae or dermatology, like where can I find them besides at Sunway?
Besides Sunway, I think what you can see is under the qualifications for all that TCM practitioners, excuse me, we have different master program in the university.
Okay.
It's similar system as like in our medical specialists. So you have gynecology, you have dermatology master, you have psychiatry master, you have even surgical master,
Okay.
things like that in TCM.
Okay.
So when you look into their qualification, see, this is master of orthopedic and traumatology. Okay. This is master in gynecology. Okay. Then you go for it.
Okay.
Just
So-
like I always ask my patient, you won't see a GP for a cancer case, right?
Yeah, correct.
So the same ideas apply in TCM.
Okay. Is it displayed in their clinic? Sorry.
Yep.
Okay.
Yep.
Okay.
So in the APC I'm sharing with you just now,
yeah.
or the big name cards standing outside the clinics, you will
Yeah.
see that all the qualification from which university.
Okay.
But most of the master program is actually offered by China.
Okay. Yeah.
Meantime, there are only one or two local university offering TCM master program.
Oh, I see. Okay.
But degree courses, I think there are about more than 10 local universities that are offering the TCM degree.
Oh. Okay.
5 years.
Wow.
It's just similar to the MBBS.
Yeah. Okay. So, going down to our last question before we move on to the myths and misconceptions. Doctor, could you share with us what is one of your most memorable cases so far that you've had since you started practicing TCM?
When I was doing my master in Shanghai's hospital, I spent 3 years there. What I can recall the most stunning condition I've ever witnessed will be the patients receiving the chemotherapy and drinking the herbal concoction at the same time in the ward.
Oh, wow. Okay.
Okay. And then in the afternoon, the patient just went out of the hospital and going to shopping around in the commercial downtown area. Because we know that most of the time after the chemotherapy, the patients tend to have a lot of side effects. Patients always feel very lethargic, and all these digestive type of symptoms will come out. But because of this type of combinations, it seems it works for them in a very harmonious way. Because our typical concern for a Western medical doctor is there any drug-herb interaction that might cause any problem to the patient?
Correct.
But in reality, when I witness this, wow, in the morning, you're supposed to lie on your bed in the afternoon because you have received the chemotherapy.
Yeah.
But you are going out and just running around, having coffee, shopping here and there. So it's really surprised me. Oh, it seems like that's how it works. It's elevate a lot of side effects and improve the quality of life of this group of patients who are so worried about the side effects and the complications from our typical conventional treatment like chemo or radiotherapy.
Okay.
So wow. Then ever since then, I feel that okay, I should actually continue to strive along this line, so to make sure more and more people knowing what TCM is about and what's good and the deeds that we are able to achieve.
Yeah. Wow, that's interesting, doctor. I mean, like you said, I think even for like patients, there's always a worry about this whole like, you know, combining Western medicine and herbal medicine as well. Could you tell us just a little bit more before we go for a break, right? Could you just tell us just a little bit more about like how TCM helps chemo patients?
TCM's we know that some of the side effects, common side effects from the chemotherapy will be the lethargy or the tiredness, and then nausea, vomiting, and then patients might have bone marrow suppressions, low white blood cell anemia, and then low platelet count, and then the patient will have neuropathy or the nerve pains. Okay, all this numbness following the chemotherapy. Radiotherapy may cause the oral ulcers, and then later xerostomia, the dry mouth, and insomnia, sleeping disorder. The night itself, they actually suffer a lot. They can't even sleep properly. So these are the things that herbal medicine is able to help at different stages of their treatment. And usually we will combine and cater for the patient's need. Sometimes acupuncture helps. We actually tell patients we do acupuncture, no herbs. Sometimes we feel that these conditions, the herbs will help more benefit as compared to our acupuncture or moxibustion, then we use herbs. So it's very tailored and personalized made. Why in reality not all patients will suffer this type of side effects?
Sure.
There are patients actually absolutely no problem. I can do whatever I want. I have patients even go out to KFC next door and then keep on eating KFC or after the chemotherapy.
Wow. Okay.
Wow. So good appetite, and then gain 5 kgs after completed 6 months of chemo. Wow. I give him a very big applause. You know? So that's the different patients, they may encounter different types of side effects. So we only assess the patients, and then we find out what's the main concern. Then we actually introduce what we can help. Rather than, you come here, definitely I will give you all these things. Else the patient will thought, wow, it will be very costly there. Come to your clinics because you are going to introduce, no. Some patients, we even chase them out, telling them you don't need the TCM's intervention because you are doing absolutely well. Just continue with it. That's how we actually only give whatever necessary for our patients. We are not drugs.
Okay, thank you so much, doctor. So let's take a short break. Have some water, doctor.
Thank you.
Before we move on to myths and misconceptions.